Hello and welcome to today's sessions on dislocation and subluxation management. So this is a very common symptom we see in patients with hypermobility, but not in all patients. It can occur in almost any joint, but some are more commonly involved than others. So the ones we most commonly see are shoulders, knees, thumbs, ankles, and they're probably the most prevalent that we see. It's our most frequently asked question by patients, and we've seen them very well managed by various patients and some very badly managed. But it's often one of the greatest causes in patients with hypermobility is that around managing when a subluxation or dislocation occurs. So let's look at the difference between a dislocation and a subluxation. So dislocation is defined as the displacement of a bone from its natural position in the joint, and this is where the two bones that form the joint fully separate from each other. A subluxation is defined as a partial dislocation. It can be no less painful than a full dislocation, but the two bones that form the joint are still partially in contact with each other. So if we look at the shoulder joint, for example, which is a ball and socket joint, a dislocation occurs when the ball, which forms the top of the arm bone, slips entirely out of the socket when it should sit within the shoulder. This can happen in any direction, but the main point is that the two bones completely separate. Whereas a subluxation, if we consider the shoulder joint again, the ball of the shoulder joint only partially comes out of the socket. So let's look at why a subluxation or a dislocation can occur. So collagen, which is a structural protein and is most commonly found in the soft tissues such as the ligaments, tendons and joints, act like guy ropes, and they provide strength, support and protection. Normally these structures tighten under tension and act to stop the two bones that form the joint from moving apart from one another. These ligaments, tendons and joint capsules play an important part in the joint stability. But in hypermobile patients, the collagen is more elastic than it should be, which can allow for the excess movement of the joint and thus causing a dislocation or a subluxation. Other causes can be altered muscle tone. So if the muscles around the joint are more lax in the first place, then it will be much higher risk of coming out of joint, and this isn't helped by fatigue, spasms or stress. Altered muscle patterning. So when some muscles switch on when they're not supposed to, they inappropriately can pull the joint in a direction it shouldn't. Impaired proprioception. So proprioception is the body's ability to sense a position and a movement within the joint and enables us to know where our limbs are in space without looking. It relates to coordination. Impaired joint position sense can cause joints to slip out of place. Repeated overstretching, otherwise known as your party tricks. Repeated overstretching a joint beyond its normal range will only exacerbate the laxity and the chances of the joint slipping out again. The joint shape and joint surfaces. So some people are born with a shallow shaped socket or other bony shaped abnormalities around the joint, and that can predispose a joint to possibly slipping out of position more easily. And then the final one is a traumatic incident, which is the most common reason for a joint to come out of place for those without hypermobility. Traumatic instances can happen to anyone, but the extra joint laxity in someone with hypermobility may actually work a little in favour with this one, as it may prevent them from damaging some of the ligaments and tissues in a way that it might do in a non-hypermobile person. So how often does a joint come out of place? So the answer to this is that it's different for every patient. Some patients get them once or twice a year, others once or twice a month, and others on a daily basis. And for some people, they never seem to stop. But either way, we need to try and reduce the frequency if we can and manage them well when they do happen. So let's look at this dislocation and subluxation cycle. So this cycle can be vicious, with more pain, spasms, panic and stress, the more often it causes, and often it causes stress to those around us as well. This isn't helpful, and if you're able to control the stress, then it will slowly help with breaking down the cycle. Even though you may not feel in control, you need to decide what things you can control and work on those. such as staying calm and trying to relax, and then making some wise decisions as what to do next. It may take some practice, but this will get easier. This is where understanding your condition, understanding what's going on, and knowing in advance the best management strategy will really help you. What not to do. Don't panic, don't take loads of medication, and don't call 999 straight away. A cycle of this is not a good lifestyle, and so let's look at the things that may be helpful to do in terms of managing this situation well. So here are a few really helpful principles to managing the situation. So the first one is breathe. Use slow, deep, relaxed breaths. Try using some relaxation techniques. There are lots of different ones out there you could try. Use painkillers. Take some appropriate pain if you have some. However, note the important word here is appropriate. You should only ever take analgesia according to the dose indicated by your prescriber. Never take more than the suggested dose. Support the joint. Try to make yourself as comfortable as possible. Use pillows or a sling if you have one and find a comfortable resting position. This allows the muscles to relax and stop them spasming. Try heat, hot water bottles, wheat bags or a warm bath, as these can help the muscles to relax. Distraction. Try to take your focus away from the pain and the situation. Maybe listen to music, watch a movie, talk to friends or family, and try a relaxation CD. This can help as a short-term pain relieving strategy, and again, it can help the muscles to relax. And finally, gentle massage. Sometimes gentle massage around the joint can help relax the muscles enough to be able to gently relocate the joint or foot to slip back into place by itself. Then what? This is often enough to allow the joint to slowly slip back into place itself. Great. But what if it doesn't? Don't expect the joint to go back in straight away. It's not unusual for joints to remain out of place for hours or even days, but once it's out, it's out. It's not going out anymore, so try not to panic. Is it dangerous? Am I damaging the joint if it comes out? These are common questions we get asked. But the answer is it's highly unlikely, because your joint laxity allows for your ligaments and capsules to stretch in a way that allows that extra movement. It's most likely that it's more distressing for you than it is damaging. But when should you get help? So if the limb starts to change colour due to a lack of blood supply, then it's important to get help straight away, or if your limb goes completely numb. Or finally, if you've tried strategies 1 to 6 from the previous page and have waited a reasonable amount of time, or you're still struggling, then I'd advise going through to A&E or to your local walk-in clinic. But prevention is better than cure, so let's reflect. What caused the joint to go out of place in the first time? Were you moving in a way that usually causes it to come out of joint? Or were you tired or overdoing it at the time? Or were you feeling particularly stressed about something at the time that it happened? Sometimes there's not a reason, but it's always helpful to stop and look back for a pattern to hopefully learn to avoid a recurrence. Try to avoid the use of supports and braces if you can. They're okay in the short term, but it's very easy to become over-reliant on them, and it's much better to train your muscles to do the job themselves rather than something else. So all this information has come from the Ehlers-Danlos Society website, and there's some really helpful information if you wanted to go there and have some time to read a bit further. But if you had any more questions, do ask your therapist. Thank you.